evening. Welcome back. It's still 92.3 Nigeria Info, your number one news, talk and sports radio station here in Port Harcourt. 8 minutes gone past 2. I'm Gabriella. Welcome to Mind, Body and Soul. This is that program where we get to talk about health and all there is to it. Well, today we'll be looking at lifestyle medicine. I've got with me in the studio a consultant family physician, Dr. Affion John, and we're going to talk lifestyle medicine. I believe it's Lifestyle Medicine Week. We're going to have that conversation as well before the end of the show. Welcome once again, Dr. John.
Thank you very much. I'm happy to be here.
Glad that you're here as well. Lifestyle medicine. Let's start a conversation with what that really is. What is lifestyle medicine?
Oh, beautiful. Lifestyle medicine is an evidence-based medicine that believes in the use of lifestyle therapeutic approaches as primary modality in the management, in the prevention, in the treatment and the reversal of chronic diseases like hypertension, diabetes, arthritis, and to restore health generally. It is not just about being a fitness enthusiast. It's about evidence. There is scientific backing to say that changes in your lifestyle is going to bring about a healthier you. And that's what lifestyle medicine is all about.
Even for chronic ailments, like you mentioned.
Oh, exactly. Especially for chronic illness. Especially for chronic illnesses.
I see.
Because right now you see that there's an epidemic of hypertension, diabetes, heart disease, cancers, obesity. And it appears as if some of us believe we are tied to our genes. But we found out that, yes, there's a genetic component, but that's very small. But your lifestyle choices play a maximal role in the acquiring diseases and displaying them.
What are the goals, or if any, there are, of lifestyle medicine?
Now, what lifestyle medicine aims to do is to put back the power of your health to the patient. Now, we have accepted for a long time all these diseases as part of aging, but really they're abnormal aging. So lifestyle medicine wants you to prevent this in the first place. What we're driving is actually the future of healthcare. We are saying that why do we wait until we have disease when we can prevent them? And we have found out that lifestyle choices will give you maximal risk reduction. And so in the first place, if you institute them early, you're not going to have disease at all. There's a chance that you won't have the disease. And then if you also do that, if you have the diseases, then you will be able to treat it and even reverse some of these chronic diseases. Exactly.
So when you say prevent it, that means even before you come down with any of these chronic ailments, you can actually begin to prevent them from happening by your lifestyle choices.
Exactly.
Okay, let's talk about some of these lifestyle choices.
Now we have what we call pillars of lifestyle medicine, and we have found out that when these pillars are upheld, that really the risk of having these chronic disease is really reduced. Okay. And number one, we talk about nutrition. You are what you eat. That saying is very true. So food is what medicine. And in fact, food has been found, scientifically proven, to be better than most of the pills we take.
Really?
Yes. And so what you put in your mouth is very important. And we want to tell people, change what you do. Whenever you're putting anything in your mouth, imagine that what I'm putting in my mouth is going to talk to my gene. Because food actually talks to your gene. And so food is medicine. And what we advocate in lifestyle medicine is what we call whole food, plant-based diet. Actually, what that means is this. It's a diet pattern that consists of predominantly plant-based diets. And including your minimally processed vegetables, your fruits, your legumes, your nuts and seeds, with minimal meat products and exclusion of processed products completely. And it has been found to ensure that you are going to be healthy. Apart from nutrition, we also talk about physical activity. You know, in our climate today, sedentary lifestyle is the norm. We are always sitting at work, we sit at home, we're watching the TV and all that. In fact, you know that television watching has been found to be a very high risk factor for cardiovascular disease.
Really?
Yes. And so what we advocate is, if it's possible, be on the move while you're watching television, because it was found to be an independent risk factor for cardiovascular diseases.
How do you be on the move watching TV?
Oh, yes. A lot of people
walking around the sitting room.
You're walking around the sitting room, you're on your treadmill, you just don't sit down for hours. We expect that when you sit down for hours, in fact, there's what we call sitting disease, which is even worse than smoking in cardiovascular disease. So we're saying minimize the number of times you sleep. So improve more, move more, ensure that you take in your physical activity. And when we talk about physical activity, it's all encompassing. We are not expecting you to become an athlete. No, we are saying your activity should increase. What you do on a daily basis. And then as you age, you should also add strength training, because as you age, you lose muscle. And so you want to add strength training, because these things have been found to actually reverse insulin resistance. And then with insulin resistance, a background for hypertension, diabetes, and all that, when you're able to do that, you have a healthier you. So that's very important. Apart from physical activity, we also talk about sleep. Sleep is a very important pillar. What we call deep restorative sleep, which is a problem today. A lot of people are not having good sleep. Some of us are what we call night owls. We work in the night. We forget that our bodies have been wired to rest at night. At night, the body rebuilds. The brain cells are able to release the toxins and the body gets repaired. But many of us have taken up to always work and work and work. And some people even brag that, I can do it with 2 hours of sleep, with 4 hours of sleep. But no, you're killing yourself. And eventually, you can't plant corn and expect to reap cassava. Once you do that, eventually you come down with diabetes, you come down with hypertension, you come down with cancers. Why? Because you didn't have good sleep. Apart from sleep, we also encourage people to learn how to manage stress. Now, when we say stress, there is good stress and there's bad stress. Stress generally is not bad, but your ability to manage it is very important. What do I mean? Our nervous system is comprised of the parasympathetic and sympathetic. I'll explain that. Now, when you have a threat to your life, the body responds by either flying, being in a flight mood, or in a fight mood, or in a freeze mood. And when it does that, the body now gives priority to what part of the body is necessary for survival, and not for that necessary for healing and repair. Now, in the other parasympathetic mood, the body is healing and repairing. Unfortunately for us, the body does not know the difference between physical stress, doesn't know the difference between emotional stress, doesn't know the difference between fear. It just does the same thing. And so you now end up being in a chronic state of stress. And you see, your body does not have time to repair. So what we're saying is, you must learn how to distress and keep your body in a state of healing and repair. Apart from that too, there is social connectedness, which is virtually lacking these days.
That's the fifth pillar?
Yes, the fifth pillar.
Okay.
Social connectedness. We are encouraging people. It is not enough to just have friends on Facebook that don't know the truth about you. It's important to have deep relationships with your spouse, with your family members, with your friends, co-workers at work. We need to love more. We need to extend hands to people. In fact, it has also been found by science that forgiveness does good to you, the person that is forgiving, and the person that is being forgiven. So we are saying love more. Connect with people. We are not meant to be islands. We are meant to live in community. That's very important. And the sixth pillar is avoidance of harmful substances like moderate alcohol intake, avoiding smoking, and illicit drug use.
Interesting. Well, 16 minutes to 17 now, gone past 2. You can join the conversation at whatever time you would like or deem fit to do. Whatever questions you might have, please do also send a message on WhatsApp. The WhatsApp number is 0809 030 6416. That's 0809 030 6416. You can also call in live 0817 923 0002 or 0003 or 0817 923 0007 or 0009. Good afternoon. All right. As you call in, I'll receive your calls and we can have a conversation. Now, when would you say modern lifestyle medicine began? Because if people are still coming down with all of these chronic ailments, like you mentioned, still looking for medical intervention here and there, and perhaps, like you say, with how confidently you talk about it, obviously seems like it works. When did it actually begin, and how effective is lifestyle medicine?
There were cohorts of people doing trials and scientific research. Actually, people had to find out, first of all, we are having this disease, we are doing everything. It appears as if there's an increase. And so a lot of people, cohorts of people in America, in the American College of Lifestyle Medicine, began to do a lot of research. And in 2004, that college was formed. But the first time the specialty was introduced as a specialty was 2017. And that was the first set of people that were certified based. It's not just a group of people that come out and say, don't take medicines and all that. They had to do a lot of researches, and studies have shown, multiple studies have shown that these things is working. And so what we're doing now is to spread the news, even among the doctors, because most doctors too are not really aware of the power of lifestyle medicine. And that's what we're doing, to tell the healthcare providers, tell the patients, tell the public that, look, there is a way you can solve the problem. I normally give this analogy that when you want to go to the hospital for your drugs, medication, what it does is, you have a tap that is open, that is running, and you just mop and you don't seal the tap. What you're doing is a band-aid, and that's what drugs do for you. But lifestyle medicine goes to the root cause, seals that tap, and then you can mop that place and then have results. So effectively in Nigeria, the first cohort was 2019, that we had the first set of people that were certified. And then last year, because of the COVID, we had to combine it with the American College. But I think sure this year we'll have more certifications done. So it's relatively a new discipline in terms of a subspecialty. But overall, there's been studies over the years.
So let's talk about how my lifestyle or my lifestyle choices can affect my health.
Okay. Now, what we're saying is this. What you do is important to your health. Because we have found that, you've noticed that people that have hypertension, usually most of them have diabetes. You see they're coming down with, they have a high risk of cancers, people that have obesity. It appears to be there's a trend that happens. Now, what we have found out is that the underlying mechanism of these things are the same. There's inflammation, there's blood vessels flow and all that. And so we're saying this lifestyle choices go and work at the background, at the root cause of the problem, and reduces the inflammation. Now, for example, somebody that exercises, what that does is that it makes you it improves it makes you better to tolerate insulin. So you don't have insulin resistance, which is like a bedrock for diabetes. And so in the first place, you wouldn't have insulin resistance, and your body can respond to insulin. And so you're likely not going to have the diabetes. And so what happens is the lifestyle choices you make. Each time you eat, you take that bottle of Coke. Remember, that Coke ages you. Just remember that. Oh, as I'm taking this thing, food has been found to talk to your gene. In fact, there's a concept we call epigenetics. It has been found that you can actually transform your genetic tendencies just by your lifestyle choices. And so if you have a genetic tendency of having hypertension and diabetes, it doesn't mean you have to come down with it. The lifestyle choices will determine what gene you express. So you might load the gun. What the gene does is to load the gun, but your lifestyle choices pulls the trigger. So you have a loaded gun, without pulling the trigger, of course, you won't manifest those diseases. And it has been found that you can actually transmit to your younger generation a better genes because of lifestyle choices.
Now, when we talk about lifestyle choices, we've talked about sleep, we've talked about the kind of foods that we should eat, also mentioned some foods and fruits and fiber, exercising like you mentioned. Some of these things, people would argue, take a while. For instance, when you're exercising and you're trying to cut down weight, as an example, it doesn't happen overnight. It takes quite a while and some bit of work and consistency to achieve. Now, would you say the same applies to lifestyle medicine? That is, if you're trying to, make better lifestyle choices in terms of what you eat, in terms of how much you exercise, in terms of, the kind of, the number of hours you put in for sleep as well. Many would say, oh, it's too much of work. Is it really work?
Now, exactly. People like shortcuts, generally. And that's why they prefer to have a pill for every ill. Now, why would I want to come down with a disease and the doctors tell you, madam, I'm sorry, you're going to take this pill all your life? I've had patients. In fact, it was the frustration of my patient that led me to say, I need to know. There must be an answer. You tell the patient, madam, you have diabetes now. I'm sorry, for life, you're going to have diabetes. And the patient just drops down. And she's going to take drugs all her life. And truth be told, whether she takes the drugs consistently or not, after a long while, she's going to have complications of diabetes. That's known. And what they used to tell us, okay, madam, be careful with your drugs so that you will not have the complications early. We can push it. Why do that? When with lifestyle medicine, we are saying, look, we can control your diabetes. It can come to a point that some are even reversed. And then you may not even have diabetes at all. So first of all, you must look at the benefits of what you're getting before you look at whether it's work or not work. That's the first thing. You want to look at yourself, how do I want to be when I'm 70? How do I want to be when I'm 80? Do I want to see... One of my passions was seeing people on wheelchairs. I'm like, oh no, this is no life. So you want to first of all look, what is the benefit before we consider the work and the cost involved. Now, when you are certain, first of all, that your health is priority, then we can now talk about lifestyle changes. Now, in lifestyle medicine, we realize that it's behavior change. And behavior change, is not easy. Usually, because we've done these things over the years, and then you have a 40-year-old that wants to change. She's been eating this thing for the past 40 years of her life, and it's not going to be easy. So what we do in lifestyle medicine, we coach you. We coach the patient. We empower the patient. We give you knowledge. We help you through the process so that eventually you have a change of attitude. Now, look at you. Talk about test buds, for example. Do you know that when you have eaten sugar for so long, you think you can't eat something that's not sugary? But once you stop it, you can't taste sugar anymore. It becomes uncomfortable because you have retrained your taste buds. It may take a while, but then it's doable. And apart from that, you also have to realize, we said prevent. Now, if you're preventing something, you know that it's going to be easier. But if you're treating, of course, what we call therapeutic lifestyle interventions. We have what we call minimal, what you're supposed to do as a minimum to keep health. Then if you have disease, of course, it's going to be more intense lifestyle changes. And so you know that you have to now be coached into the process. That's why you have doctors training and retraining, getting certified, not just following one person on internet that says that you lose your belly fat in 21 days, lose this one, all those things. They don't work. But when you, drink this, and some people meet me and say, don't, what are you drinking? Give me that you're drinking. I'm like, excuse me? I'm not drinking anything. You must make up your mind that you need to be healthy. And so when you realize that, what do I need to do to be healthy? You will now compare the costs of what I need to do to be healthy, and then look at that life of illness, of diabetes, of hypertension, of cancer. Then you now determine which one is more expensive.
Now, let's talk about the duration. While you were talking about the diabetes and the process it might take, I was thinking in my head, how long would it take, or would it need to take to treat diabetes, for instance, rather than, be on drugs all your life, or prevent complications as early as you can? Why not opt for lifestyle medicine like you mentioned? How long will that process take from the point that this person has been administered medicine for diabetes to the point where the person is almost completely free of it?
Beautiful. Now, remember, we are medical doctors, so we don't say don't take drugs. That's number one.
Okay.
I made an analogy. I said, you have a leaking tap and you're mopping, and then water is still flowing from the leakage. If you don't stop that water, you're wasting time leaking. What the drug does for you is that it leaks up that water. But you've not stopped it. So it's also individualized. Some people, depending on how bad insulin resistance is, like in lifestyle medicine, we check your fasting insulin. We check your C-reactive protein. We want to know how much inflammation have you got. Of course, somebody that is diabetic, no two diabetics are the same. So you know that this one may reverse earlier, and this other one may not reverse as soon as this other one. But the important thing is that with a short time, you start feeling like a better you. You may still be on your drugs. Now we have a way of deprescribing. You don't just stop your drugs and say, okay, I'm now doing lifestyle medicine, and so you stop your drugs. You're going to head to complications, of course. So that is why you need to be seen by the doctor, who will now gradually deprescribe. As you opt into a lifestyle medicine, as you optimize your lifestyle, then gradually you may have to reduce your dosage of your drugs. So it's not like once you start lifestyle medicine, I done my drugs and you fit it out, I'm going to no. We are scientific people. We believe in evidence. So we don't just say stop your medications, and start jogging. No. We don't say that. What we're saying is optimize your health. That's what we're saying. Some people may still do the lifestyle medicine and still be on their drugs, but minimal doses. And then they feel better. It doesn't mean that once I'm in lifestyle medicine, I'm not going to take drugs again. No, it just means that for some, they may be reversal. Then for others, they may just feel better, healthier, but may still have to continue their medications.
All right, let's take some messages on WhatsApp, then we'll go on a very quick break. This here says, Doctor, like you said, it's a new discipline. How seriously do other regular doctors take your recommendations? They have been known to tell patients to ignore those people, that is, ignore lifestyle medicine practitioners. Concentrate on taking your medicine. This leaves people like us at crossroads on if to pay heed to you or not.
Now, what happens is this. A lot of people that claim to be lifestyle medicine people and physicians are not. You have people just come and say, I'm a wellness coach, I'm a fitness enthusiast, and they don't know science, they don't know medicine. So those ones make people to have complications. But we're talking about people that, like, I'm already a consultant family physician, and now I'm board certified for lifestyle medicine. So I know what I'm talking about. I'm not going to see a patient with a very high blood pressure and tell you stop taking your medications. No, not at all. I will make sure you take your drugs, but we're going to be working at the root cause while you're taking your drugs. So it's a process. It's not like, oh, you go to church, you pray, and then you stop your drugs. No. That's why doctors say so. And many doctors have not also understood the power of lifestyle medicine. Currently, we're also trying to educate the doctors.
Even the doctors as well.
Oh, yes, we're educating them because relatively is a new discipline. What do I mean? The science is there. It's relatively new. Many doctors are coming on board. And we found out that the doctors that practice lifestyle medicine who have the testimony and know that this thing works. And so we're having many of them come on board and say, wow, it's working. And if yourself, you're hypertensive and you're seeing that it's working for you, you'll be able to tell your patient that it's working for you.
Right.
Now, but if you're not doing it, you don't know, you don't experience it, you're likely going to say, don't mind them, continue your drugs. So what we're saying is the doctors are coming on board and the patient should also come on board. But not that you should follow people on the road. We have certified lifestyle medicine physicians or practitioners, not just anybody.
All right, so we'll take a very quick break now, but you can keep your questions coming via WhatsApp. The WhatsApp number is 0809 030 6416. Don't go away.
Connect with your customers. Advertise on 92.3 Nigeria Info. Visit our downtown office at Shop 9, Mediatrix of All Gracies Plaza, opposite FIRS, Stadium Road, Port Harcourt, and book your commercials. Call 0817 001 8162. That is 0817 001 8162. And let us connect you to your customers. Connect with your customers. Advertise on 92.3 Nigeria Info. Visit our downtown office at Shop 9, Mediatrix of All Gracies Plaza, opposite FIRS, Stadium Road, Port Harcourt, and book your commercials. Call 0817 001 8162. That is 0817 001 8162. And let us connect you to your customers. Connect with your customers. Advertise on 92.3 Nigeria Info. Visit our downtown office at Shop 9, Mediatrix of All Gracies Plaza, opposite FIRS, Stadium Road, Port Harcourt, and book your commercials. Call
Nigeria Info PH. Like us on Facebook, www.facebook.com/Nigeria Info PH. Also watch and listen to us online. Visit www.nigeriainfo.fm.
Welcome back to the show. It's still Mind, Body and Soul at 92.3 Nigeria Info, the nation's #1 news talk and sports radio station here in Port Harcourt. 29 minutes on the clock. I am Gabriella, and today on the show we're talking lifestyle medicine. My guest is a consultant family physician, Dr. Affion John, and we've been trying to understand the concept of lifestyle medicine, what it is, what its goals are, how efficient and effective it is as well. And of course, this is Lifestyle Medicine Week, I believe.
Lifestyle Medicine Week.
We're going to talk about that shortly, but I'd like to hear your thoughts. Whatever questions you might have, you can share. The numbers to call are 0817 923 0002 or 0817 923 0003. You can also call 0817 923 0007 or the female line 0817 923 0009. On WhatsApp, it's 0809 030 6416. On WhatsApp, this question here says, can you cure glaucoma?
Now, glaucoma is not one of the diseases we are talking about here. So we don't claim to cure glaucoma. But if you control your diabetes, if your glaucoma, remember I said if, is due to diabetes, and you control the diabetes, if you've not already had the loss of sight, it's not irreversible loss of sight in glaucoma. So we cannot claim to reverse the sight in glaucoma. That's the unfortunate thing. Glaucoma is an irreversible loss of sight, really. So the ophthalmologists are better trained to handle that.
Well, this question here says, what is the fate of a tailor who sits down in one place for almost 10 hours every day?
Now, when you are deliberate about your lifestyle, you may have to put in short breaks in between. So whatever it is, when you know why you're doing what you're doing, when you sit for a while, you stand up, you stretch, you walk around, and you come back. That way, you're taking in the steps. What we're saying, in every circumstance you found yourself, just do the best that you can to make sure you move more. Then, if it's not possible, then you may have to change your occupation. But if that's what you have to do, then just do the best you can in the event of circumstances.
All right, so let's talk Lifestyle Medicine Week. Why this commemoration?
Now, like I said, it's a relatively new discipline. It became a discipline first in 2017 in America. And then by 2018, we had the first cohort in Nigeria. 2019, right? Okay, 2019 was the first cohort in Nigeria, and we had the first set in 2019. 2018, we had the second set in America, the Global Lifestyle Medicine Alliance. Then 2019, we had Nigerians. We had few of us certifying. And then 2020, of course, 2020 was coronavirus.
The pandemic,
And we had a few people too that did the certification. So it's a relatively new discipline. So the week actually seeks to create public awareness, both for healthcare providers and for the patients, on the efficacy of lifestyle choices. We are saying put health back into healthcare. What we've been doing before is sick care. People wait until they're sick before they seek the doctor. And so we're saying, no, can we do health care and give people health and not wait to treat them when they're sick? Let's start from when they're not even sick at all and prevent them from being sick. And when they're sick, can we change their lifestyle? Because it's amazing that you see somebody that has cancer, a diagnosis of cancer, he's still taking sugar. And cancer cells have been known to feed on sugar. And so what you're doing is you're worsening your condition. Meanwhile, there are certain foods that can help you to possibly reverse the cancer growth. Sometimes we have integrated oncology with your chemotherapy, some without. So we are saying, change your lifestyle, and that's the purpose of the week. And so for us in Port Harcourt here, we were able to celebrate the week with the entire world. So what we did, we had the Daily Lifestyle Medicine Challenge. On Monday, we said everyone should eat more plants. So that day it was go meatless. You know, it's little steps, baby steps. It's just try for one day, for 1 week, go meatless. And then on Tuesday, we said, please love more. Just show love to somebody. Don't be selfish. Reach out to that co-worker. Reach out to that neighbor. Call your friends.
Showing love is also a lifestyle change.
Oh yes, it is. It has to be deliberate. That's social connectedness. Call that old friend. It releases endorphins that helps you. It creates immunity. When you harbor unforgiveness, bitterness, you actually get ill. It's been proven. So we're saying love more. On Wednesday, we said sleep well because you need deep restorative sleep. And today's Thursday, we did the walk with the doctors that move more. And so we organized a walk. Our patients, nurses, healthcare providers, we took a walk around UPTH to lead by example. That's what we did. You can see the t-shirt I'm wearing, walk with the doctors. And we celebrated lifestyle medicine. And tomorrow, we are going to, the theme for tomorrow is become stress management. But we're organizing a lecture, a public lecture in UPTH auditorium by 12 noon to teach people about the 6 pillars of lifestyle medicine. And there we will explain to you certain things you need to know. Even though there's so much in lifestyle medicine we can't cover in one day, but at least something to empower the patient. What lifestyle medicine does is puts the power of the patient's health back to the patient. And don't look like patient is dependent on the doctor.
What's the theme for this year?
Actually, the theme is to create awareness on lifestyle medicine. That's all. We're creating public awareness. Ask your doctor. We're saying, ask your doctor next time, what about lifestyle medicine? And he doesn't know, just go on the website, American College of Lifestyle Medicine. There are free resources there, some of them. You can actually direct your doctor to go and check it out and then know about the power of lifestyle choices.
All right, so we do have some questions here on WhatsApp. This says, I am Duraku Samuel Ifai. Duraku Samuel Ifai says, I just want to know how lack of enough sleep can affect one's health. What is the minimum hours one is expected to sleep at night? For me, I only sleep 3 hours. Don't know if that is enough.
That is grossly inadequate. For an adult, you expected to sleep 7 to 9 hours every day. And it's not just the quantity of sleep, it's the quality of the sleep. Sleep is so important. You know, we have emphasized food and exercise so much because of the fitness industry.
All right.
We have forgotten that sleep is that Cinderella that was left. And these two went to the party. But sleep is so important. Without good sleep, you cannot heal. Because that's when the body heals. During sleep, that is when the body heals and repairs. That's when the body releases certain hormones that helps you to get better. And so having 3 hours consistently, you are just sowing trouble. Rather, we expected to have 7 to 9 hours, minimum of 7 hours and maximum of 9 hours. Because it's in fact that those that had 9 hours or more were more prone to cardiovascular disease. And those that had less than 7 hours also were prone to cardiovascular disease. So what we're saying, please ensure that you have between 7 to 9 hours of sleep. It's not a one-off thing. I mean, sometimes it's really not easy because of the schedules and all. But just ensure that you try to do that.
And that might mean going to bed early.
That
you have to.
definitely means going to bed early. That definitely means going to bed early, so you can wake up early. Whatever it is, just make sure that you have this minimum. You know, if it's once in a while.
Since you're talking between 7 to 9 hours, let me ask: could you break this number of hours required into two, for instance? So when you have your siesta, you can put in 3 hours, and then you have the remaining, 4 hours or 5 hours later at night. Does that also apply?
No, what we expect in lifetime medicine is straight sleep. In fact, we discourage you sleeping for too long in the afternoon. We have what we call power naps in the afternoon. Don't let them exceed 30 minutes. You don't expect to sleep 1 hour, 2 hours in the afternoon because it's going to affect your night's sleep. And then the body has a clock. It's a circadian rhythm. In the night, the body releases melatonin. You're supposed to sleep at that time. So it's not time for you to now break the sleep. Okay, I'm taking mine in the afternoon. Then I'll take some in the night. No. Rather, do whatever you have to do during the day and then take your nights and sleep if you can.
Okay. On WhatsApp still, Sunday Idigba says, Gabi and the doctor, I used to have gas bubbles on my chest. What should I do? Can I have a lifestyle doctor's number? I would also like to work on reversing high BP and heart disease. So he says he used to have gas bubbles on his chest. What can he do?
Now, remember that we can't make a diagnosis on air because we don't have the full history of what he's talking about. If he has hypertension and diabetes, wants to work on reversing it, then he should be at UPTH tomorrow for the lecture by 12 noon at the UPTH auditorium. And then from there, he'll get contact with us.
Right.
And we'll direct him.
Right. And this one says, is it possible for someone that doesn't eat sugar or any sugary foods at all come down with a high sugar level or diabetes? I easily get tired and struggle with breathing. Her BP is high and I wanted to buy. Oracle is asking. We'll come back to that question shortly, but let's quickly squeeze in some calls. Good afternoon.
Hello.
Yes,
good afternoon.
Go ahead.
I think they say too much thinking is responsible for hypertension.
Too much thinking.
Am I correct? Hello.
Yes. Is that your question?
If too much thinking is responsible for hypertension, and thinking is when somebody is thinking on how to pay his house rent and school fees and how to feed his children, and then with the drugs pay or settle all these bills. If they are telling me now that hypertension can be controlled medically, with the drugs or medicine control or pay all these bills.
Okay, thank you very much for asking. We'll get to that shortly. Good afternoon.
Yeah, hello, good afternoon.
Good afternoon.
Yeah, I want to ask the doctor. I used to have, anytime I take anything like breakfast in the morning hour, I start feeling sleepy, especially if I take something like yam, rice, beans, curry, anything at all. If I get to my office, I can't concentrate, I feel sleepy. If I get to do my work, I feel sleepy. So I usually go bare stomach from morning to like 12, 11. If I take a breakfast, I don't know if that is okay. I will need some explanation.
Thank you very much for asking. Doctor?
Okay, fine. Let's start from the last one.
Yeah.
Now he's talked about not eating in the mornings. Actually, that's a very good practice.
Not eating?
Yes, it's a very good practice. We're told that breakfast was the best meal of the day. Now, but we've also found that the body needs times to rest. So something called intermittent fasting. Those are all practices of lifestyle medicine. It's not that every day you will eat, but the times that you need to stay away from food. So we have 16, 8, you have 24. Some people have, depending on whatever you're treating, those are part of some of our tools, intermittent fasting. Now, if you feel uncomfortable, like he said, when he eats, he doesn't feel well, and then he starts eating by 12, that's awesome. Then probably by 6, he has shut off eating for the day. So he now has 6 to 12 of the next day without food. The body repairs. When you're in a fasting state, there's what we call autophagy. The body eats up senescent cells, old cells, and brings about stem cell regeneration. So it's not a bad practice at all. But if it's convenient for you, you can do water, you can do, whatever, and then eat your meal by 12. That's okay. If you feel uncomfortable. Then if you need to, for those that want to eat breakfast, once in a while you can do intermittent fasting, but you can still eat your breakfast. And then for the other question about hypertension.
Yeah.
Now, hypertension is not caused by only thinking. That's number one. It's multifactorial.
Okay.
So it's not only thinking. People are there as, but I don't think, but my BP is high. I just mentioned 6 pillars. There's also a genetic component, remember, of hypertension. Remember, there's also environmental toxins. That's why I use the word maximal risk reduction. I was careful about that. Doesn't mean that if you do all the lifestyle changes, you cannot have this disease. What we're saying is that there's maximal risk reduction. There's some you can't control. For example, environmental factors, you may not be able to control it. And now you talk about thinking. Why are you thinking about things you can't control? In lifestyle medicine, we teach you stress management. We are not saying the stress will go away, but we're saying, of what use? You're thinking about to pay your child's school fees, and then you now stress yourself, and then you fall ill, and now you have medical bills to pay. Which is better than if you manage that stress and little money you have goes for what? The child's education. So the drugs will not come and cure that bills for you. But when you take care of your health, you will not incur extra bills.
And then this question on WhatsApp from the Real Oracle, he was talking about his mother, who he says is in her early 70s, says she doesn't eat anything sugary. She easily gets tired and struggles with breathing. Her BP is high. The nurse told him to test for sugar level, but she doesn't eat anything sugary.
But she eats gari, yam, and beans. Yeah, we're not talking about just sugar. As bad as refined sugar is, it is not the only cause of diabetes. Now, we said it is multifactorial. That's what I want us to understand. It's not one thing that causes it. We have people that have eaten sugar all their life, they don't have diabetes. And we have those that have not eaten and they have diabetes. So it's not as if it's a one-size-fits-all. We are talking about maximal risk reduction. So if she's 70, and how much of all the other pillars has she practiced? So it's important to check her sugar level and be sure that she's not diabetic. Now, if she's diabetic, she can change her diet. Her mother may be eating meats all the while and eating carbohydrates, high, refined carbs.
Yeah.
So not necessarily sugar as in sugar.
That's very true. All right, so we have just a few minutes left for this conversation. Let's squeeze in some more calls. Good afternoon.
Hello, good afternoon.
Good afternoon.
My name is Zinebari. I want to know the difference between exercise stress and working stress.
Exercise stress and working stress.
Yeah, that is, yes. The different effects of these things.
Okay.
That's the stress you get from exercise and the stress you get from work. I want to know the difference between it.
All right. Thank you for asking.
It's all right. Now, exercise is stress. Remember when I talked about stress, I said good stress and bad stress. I made that statement because what happens is exercise also causes the body to release cortisol. But on the contrary, it's beneficial and it's for a short while. Different from chronic stress that puts your body in that sympathetic flight or fight state. So exercise is what we call good stress for the body. While the other stress, the work stress, the mental stress, the emotional stress, and some of us have what we will call you're anticipating the stress. You are just saying, oh, this relationship may not work, and then you are thinking about it. The body does not understand that, and you are now in a state of chronic stress. So that is what takes care, that makes you go into chronic disease. It is not the short stress. For example, you see a tiger, you see a lion, and your body releases cortisol. It makes you able to fly or fight. That's not going to give you chronic disease. Is that chronic stress? You come out from your house, you're having relationship stress, emotional stress from the husband, you enter the road, there's traffic, and you're already busy early in the morning, you get to work, your boss, there's that chronic stress there. That's what causes disease. Not that stress completely is bad.
All right. This message here on WhatsApp is asking, is it okay for one to always eat at 3 a.m.?
It's not okay at all to eat at 3 a.m. Very bad, because you're not allowing the body to heal and to repair. We just said the body needs time to rest and digest, and then you are giving the body work. Once you eat, it's like the body now has to recruit soldiers. Oh, come on, there's work to do. Let's go get there. And they don't have time to repair. So it's good to stop eating early in the evening. Whatever time, you fix your time and don't eat too early in the morning. Give your body time to rest and repair.
All right, back to the phone lines now. Good afternoon. Oh dear. Do want to call back 0817-923-0002 or 0003. You can also call 0817-923-0007 or 0009. Good day. Is it healthy to drink up to 1 liter of water in the morning? That's how I do, and eat around 11 a.m. or sometimes 12 noon. But I ate late last night. Let's say by 11 p.m. to 12 a.m. Is it okay? Because it's hard for me to stop this.
No, it's good to drink water in the morning. What we're saying is hydration. I didn't mention that, but you need to hydrate. There's no time to talk about everything. You need to hydrate properly. But eating 11 to 12 is not good. It shouldn't be a habit. You should make effort to stop that. But it's good to take your breakfast by 11. That's okay. And then you take water in the mornings. That's okay. It's going to help your body to heal and repair.
Well, Martins is asking on WhatsApp, how do I treat prolonged ulcer ailment? It gives me constant severe back pain.
These are not things we treat on the radio station. So please, you need to see a doctor to be able to know how to go about your medications.
All right, our final caller. Good afternoon.
Good afternoon.
Good afternoon.
I want to ask your guest in the studio. If you are above 50 and you have a constant being bombarded every night with generator noise, and that raises the sugar level. Currently, I have a couple that is having sugar level issues. I think the one is at a 50, the two are having sugar level issues. And their lifestyle, if it is true, they don't eat sugar like that in the home.
Okay, so you're asking if generator sounds can also affect one's health?
Huh?
You're asking if generator sound can also affect one's health?
I'm asking.
Yeah, that's what you're asking, right?
Yeah.
Okay. Thank you for asking. So he says he has this couple, these neighbors who have high sugar level, and he's asking if the sound of generators in your neighborhood can also influence a person's health.
It's going to be a bit. It may be an indirect cause, really. Now, I said chronic diseases are caused by genetics, environmental factors, and lifestyle choices. Now, remember, what we're talking about now is the lifestyle choice. That's what we say, maximal risk reduction. Environmental factors is about the kind of air and the quality of environment we have. It may not cause the disease, but it can worsen it. Now, we are not going to say it's caused their diabetes, but we also know that there's, in the concept of rest, there's what we call sensory rest. When you're sleeping in the night, there's the need for quietness. Even that sound that you run the gen, if it's not curtailed, some gens can be very troublesome, then you will not be able to have a good sleep. So you now see there's a lack of sleep now that is affecting your diabetes. Not necessarily directly the generator. And then the fumes and all that gives you unhealthy air to breathe.
Okay. Well, we have some messages on Facebook. Peter Montu, he's asking, I'm not quite certain what your question is, but he says, what state am I in now with arthritis? I don't quite understand what that is. Anyway, Mustafa Coco, Becky, George, thank you for your comments on Facebook. Sadly, we're out of time. Let's talk about how people can participate in this year's commemoration. You already mentioned you have a lecture tomorrow.
Tomorrow.
What time?
12 noon. 12 noon at UPTH Auditorium. That's going to be the final, the whole week-long activity. So we're going to have a lecture to expose people to the pillars of lifestyle medicine and to tell them, we have a lifestyle medicine clinic too in UPTH that is up and running. And so you can actually visit us at the lifestyle medicine clinic for your healthcare concerns. And so we will take you through the process of coaching, take you through the process of investigations and all that.
So finally, what are the most important things that people must know when it comes to lifestyle medicine?
Now, what we're telling people is take back your health. Decide how you want to live when you are older, and it starts from now. Make up your mind that you are going to have good health, and it's going to be influenced by your lifestyle choices. And so take these pillars very seriously, work on them, baby steps, and you will improve. But make it consistent. It's a lifestyle. That's what I'm saying. It's lifestyle. That is not something you do. Oh, I used to do it to the gym. And no. I go to the gym 1 week, 2 weeks, and then you are off the gym. And then next year you start again. No. We're saying make it a lifestyle. And then we help you to make it a lifestyle and get your health back.
Thank you very much, Dr. Affion John, for your time. I appreciate you being on the show.
Thank you very much.
Yeah, I've been speaking to Dr. Affion John. She's a consultant family physician, lifestyle medicine. I wish you a very good afternoon.
Thank you very much.
And this is where we're going to wrap the show up on the sunny side today. Don't forget you can connect with us on socials, on all our social media platforms at Nigeria Info PH. And you can also keep in touch with me on socials as well, at Kabani on all social media platforms. At 3 o'clock, Rivers Today comes up, and right after, Dio will take you on Hard Facts. Talk to you again tomorrow. Good afternoon.